I'm Mike Allen. I'm employed by the Mary Lanning Hospital Trust. I am also a member of the Board of Trustees for Mary Lanning Healthcare. I've been in the community for about 31 years. The trust was started in 1918, around the same time as Mary Lanning Hospital was started. And it was started by some of the same people. The three of the first five board members were William Lanning and Thomas Fromm and R.R. Demerel, and they shared their passion for providing health care for the community, not just in the creation of the hospital, but in creating the trust, which was a vehicle for to create a permanent endowment in support of primarily the hospital, but the health and well-being of the community of Hastings and South Central Nebraska. Well, the trust was a very significant part of the financial platform in support of the hospital back when it was started in 1918, primarily due to the same individuals. There were three primary benefactors that left significant holdings to the trust in support of Mary Lanning, and that would have been William Lanning, Thomas Fromm, and his brother Klaus. Between those three individuals, they created 6 of the 13 trusts that were left to the Mary Lanning Hospital Trust in support of our healthcare system. The principle has been preserved throughout our almost 100-year history. The investments are spent, the income from those investments are spent in support of hospital. It doesn't go to the operations of the hospital. The hospital is an operation. Its operational expenses are covered by its internal operations. The investments, the distributions that the trust makes on behalf of the hospital are used to create for improvements to the hospital, such as the Morrison Cancer Center, which credit to the Morrison family for that huge investment. But now we're making additional investments in a new linear accelerator to provide enhanced cancer care, a number of capital improvements to continue to evolve and provide health care facilities and treatments that are always new and evolving. We are providing care to everybody in the community. I'm talking by we, the trust, the hospital, the foundation. But that's a huge undertaking, and it requires a lot of investing by the people of the community to continue to provide that level of health care. The most important thing for me would be to make sure that people of Hastings understand that this is their hospital. It is governed by a board of trustees that are local representatives of them to manage their healthcare facility. It's not a board of directors. It's not managed in some other city for profit, for some other reasons. The hospital exists, the healthcare system exists today just as it did when the Fromms and the Lannings, William and Alice, started it, and the Fromms invested in it to make sure that there was a viable long-term healthcare delivery system that provided the highest quality healthcare to everybody in Hastings and South Central Nebraska. And it's important that people understand that. It's the hospital, Mary Lanning Healthcare is not the 600-pound gorilla. Mary Lanning Healthcare is the people of Hastings and South Central Nebraska healthcare system, and we need to support it as such.